Today, I want to talk about something a little playful, but also serious. I call it junk food health content. The kind of videos that shout about losing weight overnight with no effort. Foods that supposedly mimic a prescription weight loss drug. Guaranteed instant sleep. One trick nobody will tell you, or the hidden truth the industry is supposedly keeping from you. You have probably seen them. You may even have clicked on a few. And if you have, there's nothing wrong with you. We are all living in a system that has learned how to press our oldest buttons. People assume and sometimes call that fast automatic part of us, the lizard brain. It reacts before we think, scanning for danger, quick rewards, and the fear of missing out. It hates uncertainty and loves simple promises. That is exactly the part of us that likes these viral titles. And of course, that's the viral titles that are designed for us to poke us. Take a little promise that you can lose extra weight overnight with no extra effort at all. Won't you want to watch it to see what it is? What it really means is that imagine getting results with no work. It dangles the dream of change without cost. Or take the grocery list that acts like a prescription style of title. What it really suggests is that you can take medicine level effects from everyday foods without side effects, without trade offs, and without the reality that prescription medicines work differently from nutrition. A promise of instant, guaranteed sleep sounds as if there is a single magic technique that will switch off the brain on command, no matter what else is going on in our lives. In reality, it usually means here is a relaxation technique, just a routine that might help someone some of the time. But the title quietly suggests this will fix your insomnia tonight. Then there are titles that imply secrecy. The one trick, the one trick nobody will tell you. Just watch this video. It hints that there are special knowledge your doctor is hiding from you and that the system is clinging to old ways. It stirs up a mix of anger and curiosity. What are they not telling me? And the hidden truth style about medicine suggests there is a simple, shocking fact that common treatments that has been deliberately kept from us all this time, and something that you can uncover by watching this video. Wouldn't you like to watch it? So the technique is simple. These titles do not start by asking, what is the fairest way to describe the evidence? They start by asking, what fear, what hope or secret can I tap so that our fast brain, our lizard brain, clicks before our thoughtful brain catches up? Effortless results, instant fixes, secret shortcuts, and a hint that we are smarter than our doctor, than all the other people, our friends. We have this secret knowledge. That is the recipe. That is what I mean by junk food health content. These videos are built with the right mix of fear, hope, and outrage to make us click and watch and keep watching. They often begin with a grain of truth, a grain, only a grain, maybe a real study, a real technique, and a real side effect. But the truth is stretched until it no longer looks like real life. On the other side, you have what I would call carefully cooked health information. It's quieter, it uses unexciting phrases like it depends, And we are still learning, and it keeps side effects and uncertainty on the table. It respects the fact that real institutions, real academics, real lives are messy, that no single habit or supplement can change everything. So, which one does YouTube show us more of? Most of the time, it is junk food. Not because people at YouTube are trying to damage anyone's health, but because the recommendation system notices what many people click on quickly and react strongly. And so it keeps showing these junk food. And yes, people do enjoy junk food. You know that. I know that. A miracle promise gets more clicks, more emotion than a calm explanation. So the system quietly serves up more of the same, more and more. Here is a deeper problem. Many of you watching this are not 23-year-olds scrolling for entertainment. You're in your 50s, 60s, 70s, and beyond. You may already be on several medications and worried about your heart, your brain, your bones, your balance. For you, health videos are part of how you make sense of serious decisions. Junk food health content can warp those expectations. It tells us that before we ever see our doctor, that there must be a secret out there, maybe that the doctor is hiding from you, or the pharmacy companies are also hiding. They're not telling us. They're not telling us that there is one secret habit that melts fat, one secret trick that guarantees instant sleep, one simple supplement that fixes everything, fixes your hormones, fixes your pain, and one test that will reveal the truth that our doctor and the industry have supposedly been hiding from us. And when real life does not match the promise, you are left disappointed and more distrustful, or chasing the next secret, the next fad. So, how do we protect ourselves without switching off completely? The first step is to notice the flavor of the title. If it promises a miracle with almost no effort, instant results, or a secret that they do not want you to know, that is a bright warning sign. It is designed to make our fast brain, our lizard brain, feel a rush of excitement or fear before our thoughtful brain has a chance to ask the questions and think carefully or rationally. And the second step is to run a clinic test in your head. Ask yourself, if I repeated this sentence out loud to my own doctor, would I feel a bit silly? If you would not feel comfortable saying, I heard there is one trick that fixes my sleep instantly, or I heard that there is a food list that works like a prescription so that I don't have to take these pills that you're prescribing me, then the video is almost certainly overselling. The third step is to notice how you feel after the video, not only just during it. Real, carefully prepared information might feel heavier in the moment. You may hear words like, on average, for some people, we are still learning, but you should walk away with more clarity and a sense of what you can realistically do next. Junk food videos often leave us overexcited or deflated and strangely hungry for the next big promise. On this channel, I'm trying, imperfectly but sincerely, to stay out of the junk food kitchen. That means some of my titles will never compete with miracle promises. It means you will hear me say things like, this helps a bit, but it is not magic. and we do not know yet all the information. For example, we do not know or we do not have good long term data for people perhaps over 70, or the data is up to 5 years or just 10 years. It means that I will keep reminding you of your age, of your other illnesses, of your medication, mattering more than any single headline. And this is not a date end. Over the next few months into the new year, we will look calmly at every topic that gets hyped in those junk food titles: weight, sleep, tiredness, dizziness, bruising, skin changes, memory and brain health, vitamins and supplements. The subjects will be familiar and the style will not be. There'll be no miracles, no secrets, just clear, plain, honest explanations for life that is ours to live and enjoy.